When do we need an expander? So expander is usually placed in a kid's mouth before the age of 10. And the reason is because there's a suture in here that closes. So if you want to do an expander, if you need an expander, you should do it before the age of 10. So that being established, do you need an expander in every single child that is less than 10 years old? No. The only time I do an expander in a child is when they have a crossbite. What does crossbite mean? Crossbite means that your top teeth are inside the bottom teeth. So think about a box and a lid. That's how the bite is supposed to sit. The lower jaw is the box, the top jaw is the lid. It has to overlap the bottom teeth. If you have an opposite problem, then you have a crossbite. So if a child less than 10 years old has a crossbite like this kid right here, he needs an expander to correct it. And so we do an expander and it's pretty fast. 4 to 6 months, expander is done and you can see the bite is corrected. Why do we not want to leave a crossbite behind? The reason is if the lower jaw doesn't fit in the right spot, let's say it fits like that, that means the lower jaw is going to start growing in this direction. I'm exaggerating my movements here. But if the jaw fits like this, it starts moving in this direction. Now, once the child starts growing in this direction, you cannot reverse the course of that. And you'll need surgery when they're teenagers to correct it. So if you have a crossbite, you always correct the crossbite with an expander. Now, some orthodontists believe that you should do an expander to make space for the adult teeth. Now, I don't have that belief system, and I'll explain why. The reason is, so let's say if a child is 8 years old and you're making room for the teeth that are going to come in at 11 and 12. So if you make room now for these teeth that are coming at 11 and 12, how are you going to maintain that space? You have to give them a retainer, otherwise the teeth are going to go backwards. So if you can give them a retainer that's going to last them all the way from age 8 all the way to 12 or so, sure, it makes sense. But can you put a retainer, sorry, in a kid from age 8 all the way to 12? You can't because they're going to grow out of it. So if you cannot maintain it, then why are you doing an expander?